Come to order. Ms. Sewell.
Thank you, Mr. Chairman. First, I'd like to thank all of our guests for being here, and especially you, Ms. Williams. Your testimony was very powerful and is the reason why my colleagues and I are fighting for the 24 million members of Americans that depend upon the ACA. Unlike the billions of dollars that many of the insurance companies are making, many of the hospitals in underserved rural and urban areas like the ones I represent in Alabama do not see millions or billions in profits annually. In fact, many of the hospitals in my district operate either on thin margins or simply in the red. Some of my hospital administrators often pay staff out of their own pocket and operate month to month to month. This is especially true because Alabama, like 9 or 10 other states, did not expand Medicaid. So our underserved urban and our underserved rural areas are really in dire straits. Added administrative red tape and burdens do not make it easy for rural hospitals to receive timely payments. I've spoken in this committee time and time again regarding the painful Medicare Advantage prior authorization process that negatively affects DCH Regional Medical Center in Tuscaloosa, Alabama. Today, I want to share the experience of Hale County Hospital in Greensboro, Alabama, which is another facility that's in my district, but in the rural part of my district. Hale County Hospital has had ongoing issues with Medicare Advantage billing due to incorrect coding, delayed prior authorizations, retroactive denials, and quite frankly, the list goes on and on. United Healthcare has a significant share of the Medicare Advantage in my district and marketplace beneficiaries receiving treatment at this particular hospital. United has also negatively contributed to the billing chaos. The ongoing problems related to billing, including inpatient visits being classified as observation, and even physical therapy services being filed under the hospital's home health services, have resulted in reduced payments to the hospital. The hospital administrator has paid legal fees and currently is paying a revenue cycle consultant to assist with the thousands of claims that they're only given 30 days to address. These costs are additional unnecessary burden on our hospitals, and the staff at the hospitals describe it as a nightmare. Mr. Helmsley, I want to thank you. I had an opportunity to share with you what was going on in Hale Hospital, and you responded this week. In fact, the hospital informed me and my office that this was the first time that United Healthcare had escalated their concerns despite hundreds of calls. According to Kaiser's Family Foundation, 3.2 million people, 3.2 million prior authorizations were denied in 2023 in Medicare Advantage, and 81.7% of those that were denied were appealed, and upon appeal were later overturned, which really begs the question, why were these claims denied in the first place? So I really wanted to ask you, Mr. Helmsley, what are you and United Healthcare doing to try to make sure that you meet the moment, especially in these small rural communities that I represent that didn't expand Medicaid in my state and literally depend upon timely payments and prior authorizations that are appealed and then granted takes 90 to 120 days for them to receive their payments, and it simply teeters them on the edge. And I know while I'm addressing this to United Healthcare, all of you have similar concerns, or people back home who have similar concerns about timely payments and making sure that we're doing all that we can to get folks the help that they need. So can you speak a little bit about what you're doing to address that?
Sure, thank you, and thank you for the issue and for bringing it up when we met, because once we know about something, we can address it. But
you know, and I know that not everybody has
Yeah, no.
can appeal to their congresswoman and have their congresswoman call, which is why I think it's so important that we make sure that everyday Americans have access.
Totally. So we are pursuing an effort to what we call real-time kind of processing, so that we cut through that complexity. Most of which, as I indicated before, is administrative in nature, not clinical. And I think that we can do more to own that and use technology more effectively. Sometimes it is more challenging in rural settings, but I think we're conquering that. We have a pilot out in 4 markets, 4 rural markets.
And we would love that pilot to come to Alabama. I think we talked about that.
It is headed your
You know,
way.
I think that at the end of the day, while lots of, you know, insurance companies have this problem, you are, United Healthcare is an outlier in the sense that you guys have the most. And so whatever you can do to continue to be responsive to the needs of the patients, I would suggest that you do.
Totally agree.
Mr. Speaker, I know I, for one, and a member of Congress that will talk to the CEOs. And so I say to all the CEOs here, watch out and accept my calls when I call.